You do also some other really interesting things at the eHealth Center of Excellence, such as making bots that I mentioned previously at the intro to this episode. So tell me more about that work and how that came about.
Yeah, it really came about because clinicians were burning out. And we know that even before the pandemic, it was an epidemic, right? Where clinicians were burning out, people were leaving practice, retiring early, having significant issues with, maintaining their practices. And so, we had to find a way to help out. And when you look at what clinicians sort of go through, there's a lot of administrative processes. 40% of time or more is taken up on just administrative work. um, and looking at other industries, they've been able to figure out ways to do that, ways to automate certain things to reduce the administrative burden. And so that really spurred me to say, we can do that in healthcare too. Like there are a lot of repetitive routine processes that we do that are not value add patient care. So can we do something to sort this out? And there's a lot going on about automation, artificial intelligence in the environment. And so really understanding that there are some opportunities there. Other industries, insurance, aviation have used automation to help with the process. When you go to check in for your flight, that a lot of that's automation software that's actually figuring it out and processing that. And in the aviation industry has found out how to communicate between disparate systems and disparate airlines and things. And so, in healthcare, we have an opportunity to leverage the same technology.
Mhm.
So, we did similar with, what I said before is we did a proof of concept to really look at can bots. So these are software programs, repetitive routine, that do repetitive routine processes. They're not walking, talking bots, but programs that, software programs that work 24/7. They don't take coffee breaks. They don't complain unless you want them to. And so we deployed some bots to really help with a few different things like sharing of information between systems and improving data so that electronic medical records can use the data for reminding patients or tracking patients. And we saw that there was tremendous value
Mhm.
in that. It supported clinicians in their workflow. They took on some of the burden that clinicians had. And so we started with that, and now we have a bot family really that's doing a number of tasks for clinicians.
Okay, but here's a real kicker. Tell us about the names of those bots and their functions.
Yeah, yeah. So this is the fun part. Yeah. So why not have fun when you're doing this work? And so our bot family includes Cody. Cody is a bot that goes into the medical record and codes diagnoses, and that's important because then you can automate functions and flag patients who have heart failure, depression, chronic kidney disease, and so really important foundational piece in terms of getting the data that you need. And in primary care, you don't have coders who actually standardize data. So the bots actually are able to do that. We have Bernie, the bot. Bernie burns out, so physicians don't have to. And so Bernie does things like in COVID. Bernie's been documenting COVID vaccines. It saved one clinic 87 hours of time
Wow.
documenting COVID vaccines. And so really, these are the tasks that we should get automation to do. And so Bernie's, doing a lot of other things and burning out like preventative care, looking at test follow up. So, if you order a lab test, have you completed the lab test, which is a college requirement? And so Bernie is looking to follow that up. And then we have Sharon. And Sharon shares data amongst disparate information systems. And so Sharon is working on sharing data between primary care and home care as a start. And so, that's a big problem as we look at sort of moving forward. Patients have to repeat their story multiple times. And so if we can use these bots to, essentially transfer information between one system and another, like swivel chair tasks, if someone is re-entering information into another information system, bots can very easily, copy and paste that information, put in the right spot. So as a physician, you have the information there at your fingertips in your system, and you're able to add to it. And when you add to it, in this case, the home care system would get updated
Yeah.
with that information. So Sharon has been, developed to do that. So that's our family so far, and we're really looking at other opportunities to expand the family. And we grow quite fond of these bots. The clinicians who we saved time, the 87 hours, they wanted to hug the bots, because they were so impactful.